Today we will be talking about Native Americans. This is a cultural-based group project done for Troy University by Shana Mowry, Vera Patty, Tiffany Pollard, and Lauren DuPont. Native Americans were the first group of people to inhabit the Americas. They have their own culture, economic system, and laws. They are made up of different tribes that represent their own nations. The term Native American refers to the members of the Indian tribal nations, Alaskan Natives, and the Aleut population who live within the United States. This is an extremely diverse group with over 500 distinct tribes. Now we will discuss some statistics in relation to Native Americans. There are 564 federally recognized Native American tribal governments in the United States. In 2010, Native Americans represented almost 1% of the U.S. population, or approximately 2.5 million people. The average life expectancy of Native Americans is more than 5 years shorter than that of the overall population in the United States. 72.6 years versus the United States' 77.8 years of life. In 2009, 25% of Native American Indians met the federal poverty level guidelines. Unemployment rates on many reservations ranged from 50% to 69%. Diabetes affects Native Americans at an astounding rate. They are 2.6 times more likely to be diagnosed with diabetes than non-Hispanic whites of a similar age group. In 2008, the incidence of end-stage renal disease among American Indian and Alaskan Native people was twice that of whites. Lung cancer is the leading cause of cancer death among Native people. Lung cancer rates among women in the southwestern region are 7.3 per 100,000, whereas the rates among northern tribes for women are 43.2 per 100,000. For men, the rates in the southwestern region are 13.3 per 100,000 and 77.1 per 100,000 in the northern tribal areas. According to the Behavior Risk Factor Surveillance System, the incidence of heart disease from 2006 to 2010 was much higher among American Indians and Alaskan Natives. In addition, the prevalence of risk factors for heart disease, smoking, obesity, sedentary lifestyle were higher in American Indians than in any other at-risk racial groups. Every tribe has its own unique language and culture. Their languages allow them to know their history, family, ceremonies, medicines, and stories. Roughly about 20 of the 170 Native American languages in the U.S. are still being passed down to the next generation. There is a debate over what to call the indigenous people of America. The terms American Indians, Native Americans, or First Nations are incorrect because these are European terms. It is preferable to refer to each tribe by its name, and certainly tribal members refer to themselves by their tribal names. For example, Navajos call themselves Dene, the Creeks, Muskogees, the Choctaws, Choctaws, and so forth. The general accepted term by the U.S. Census Bureau is the American Indian and Alaskan Native. This term encompasses any of the original people of North and South America, including Central America, and who maintains tribal affiliation or community attachment. Currently, there are more than 560 federally recognized tribes in the United States. Additionally, there are almost 245 non-federally recognized tribes. On this slide, by clicking the link below the picture, you'll be allowed to watch a video of the culture of Native Americans. Expression of emotion and feelings is often communicated through nonverbal gestures. For example, American Indians may look down to show respect or deference to elders, or they may even display disagreement or displeasure by ignoring an individual. Oftentimes, American Indians communicate difficult messages through humor. They may convey a difficult message with a joke or laughter. It is often believed that laughter is the best medicine, and it is used as a coping mechanism. American Indians have a strong respect for spirituality and religious beliefs, whether traditional or Christian or a combination of both. It is a common belief among American Indians that social and health problems and their solutions can be found in a balance between mind, body, spirit, and even the environment. Gender roles can vary significantly among tribes. However, males and females typically have very distinct social rules for behavior in everyday interactions. Elders play a significant role in tribal communities. They are considered valuable in the decision-making process. Death and dying practices vary greatly from tribe to tribe. However, after a person dies, some tribes will not touch the deceased person's clothing or personal belongings. In the American Indian culture, children are highly valued and are given responsibility early in life regarding personal decisions. As the younger generation ages, their ties to their tribe remain strong, drawing them back to their reservation to visit family members. American Indians value wisdom that comes with age, and they hold their elders in high regard. Elders are thought to be wise as they have greater experiences and broader perspectives. American Indian elders are at increased risk for heart disease, hypertension, diabetes, vision problems due to retinopathy, functional decline due to arthritis, osteoporosis, and diabetic peripheral neuropathy. The quote-unquote family relationship among individuals can become quite complex, as it extends beyond blood relatives to friends and other tribal members who may be given the relationship of family based on the closeness and role they play in one another's lives. These relationships are also reflected in their child rearing practices and how they care for their elderly. For example, in the Brothertown Indians, aunts play a vital role in raising children. It is also culturally accepted that the extended family provide care to the elderly family members. American Indians experience a significant lack of employment opportunities in comparison to other Americans and consequently are highly likely to live in poverty. According to the 2010 U.S. Census, the median household income for American Indians was $35,062 compared to $50,000 for the U.S. as a whole. In fact, the 2010 U.S. Census found the poorest communities in the United States were the American Indian reservations, and some reservations reported that more than 90% of the money circulating in their communities was from a variety of federal funding. Healthcare concerns are among the most prominent issues facing American Indian tribes today. For most tribal communities, the primary health care is the Indian Health Service, an agency of the U.S. Department of Health and Human Services. The IHS is charged with serving the health needs of American Indian population and operates hospitals, health centers, school health centers, and clinics throughout 12 regions across the continental United States and Alaska. Almost 30% of Native Americans are without health insurance compared to 16% of the general population. Given these health disparities, the fact that Native Americans are less likely to have health insurance than their non-Native counterparts presents an especially concerning situation. Overall, Native American children are less prepared for school than other ethnic groups. Native American children are twice as likely to be living in poverty, approximately 34%, than the general population. They are less likely to finish high school or have parents who did. In 2005, the dropout rate was 15.5%. They also have students that have had the highest absentee rate in the county of any race or ethnic group in 2005. This is certainly a risk factor that must be considered. Only 67% of Native Americans were graduating from high school, and of these, only 9.3% went on to pursue and achieve a degree in higher education. Performance on the SAT assessment throughout the U.S. is one way they use to evaluate the levels of reading, writing, and math within the country. In 2009, Native Americans scored an average of 486 in reading, 493 in math, and 469 on the writing portion, in contrast to the average scores of the non-Hispanic groups of 528, 536, and 520. Many of the Native Americans combine traditional tribal practices within Western medicine. However, they do acknowledge the two are distinct and separate, though complementary. Important factors to consider when caring for a Native American patient are to be warm, friendly, and smile. Handshakes are appreciated, however, not common traditional greeting between tribesmen. Avoid extending lingering eye contact as it can be seen as disrespectful. Take your time and speak plainly. Also, it is essential that the practitioner respect and utilize silence as the Native Americans do in their own culture. Understand, appreciate, and accommodate the patient's wishes to amalgamate the tribal therapies, rituals, and ceremonies within the Western medicine plan of care. Expect to include the extended family and elders in the plan of care as well. They all take a very important role in caring for the patient. Sometimes consent has to be obtained from the tribal elders for procedures or treatment. It is crucial to understand the acceptance to use Western medicine does not indicate the Native American patients understand health promotion, prevention, and maintenance. The family structure of Native American people is very different from our own. For Native Americans, family went beyond their parents and siblings. Their families were very open and formed what is called an extended family. And these extended families were many households that came together to form a small community within their tribe. Some were patriarchal, while others were matriarchal, where the women of the tribe hold honored places in the society. Though this is the case with many of the tribes, Native American women suffer violent crime at a rate 3.5 times higher than the national average. Domestic violence and abuse is rampant among Native populations. 6 out of 10 Native women will be physically assaulted during their lifetimes. And as alcoholism is a common affliction of this ethnic group, a study showed that 75% of the incidents occurred with an absence of alcohol in their party. The elders of the tribe are held to the utmost esteem. They are looked to for wisdom and guidance. They have seen many changes and suffered many unprecedented challenges that younger members of the tribes value. They also serve as the caregivers among the family and may find it difficult to be the ones to be taken care of instead. This change in roles can be quite the transition for elders. In a study represented by several authors, they suggested the historic trauma suffered by these tribes will still have a very strong effect on these tribes. It is suggested that this trauma and its adverse effects have affected the family unit and health of the Native Americans. Treatment models, interventions, and programs have been designed to address the historical trauma, loss, and unresolved grief among the families and tribes of the Native Americans. It is important to evaluate the sense of cultural and family identity of these patients. More than any other ethnic group in the United States, the Native American nutrition and diet may have changed more in recent years. It very closely resembles that of the U.S. Caucasian non-Hispanic population. However, it is found that the quality is much poorer than that of general population. A recent study found that 10% of Native Americans have a healthful diet, while 90% need significant improvement in this essential area of life. As an overview of according to Internet Frequently Asked Questions Archives online education, the majority of Native Americans have diets that are too high in fat. Only 21% eat the recommended amount of fruit on any given day, while 34% eat the recommended amount of vegetables. 24% eat the recommended amount of grains. 27% consume the recommended amount of dairy products. This may be attributed to the fact that 79% of Native Americans are lactose intolerant. Native Americans are also 4 times more likely to report not having enough to eat than other U.S. households, and this could certainly be attributed to the extreme prevalence of poverty within this cultural group. It would seem that one of the main goals of the practitioners of cultural group would be to prevent or delay onset of diabetes, obesity, and other chronic conditions and diseases that stem from a less than optimal diet. Throughout these slides, we have presented to you some of the most important parts of the Native American culture. Despite the extremely diverse cultures of the Native American tribes, they all share many health and illness beliefs. It is crucial that the practitioner take these two into consideration when planning and diagnosing Native American patients. The following are a few significant examples. Life comes from the Great Spirit, and all healing begins with Him. Man must be treated in mind, body, and spirit. Wellness is obtained with harmony of the body, heart, mind, and soul. Death is not to be feared, but is a natural part of life, just as birth. This spirit leaves before and after it is in the body. Disease is felt by all members of the family, not only the person affected physically. Mother Earth provides many remedies, so do not discount their value. Native Americans believe that the goals of their religious and tribal rituals and ceremonies are to eradicate the cause of the illness and not just to alleviate the symptoms as within the Western medicine. These ceremonies are generally organized by the Native American Church of the Paleolite religion. Health is viewed as a balance of the spirit with nature. Health promotion is more about healing the person than curing the disease. Illness is an unpleasant topic, and they are often uncomfortable discussing it. Family members in the community become increasingly important when discussing diagnosis and treatment programs. They are viewed as a source of support, strength, comfort, and assistance. In traditional Indian life, work is always directed to a distinct purpose and is done when it needs to be done. The non-materialistic orientation of many Indians is one outcome of this value. Only that which is actually needed is accumulated through work. American Indians favor a heavier body image and consider obesity normal, and in contrast, find thinness as a cause for worry or concern. Native Americans often have specific dental features different than other cultures. Bulky and winged incisors with a small gap between them, or shovel-shaped incisors instead of being completely flat on the back. Their bone structure is another traditional characteristic that differentiates them from others. Their high cheekbones, crooked fingers, inverted breastbones, and little toes that lie under the next one. Other features include almond-formed eyes, lazy eyes in kids, thick, heavy eyelids, and a pigmentation in the back of the eye or the retina. Other physical findings were discussed in previous slides, such as their weight and their thoughts that obesity is much better than being thin and causes lots of worry. Native Americans value both humility and harmony. Some even will underperform to avoid seeming superior, to not disrespect the traditions of their cultures. This is seen in school and work. The Native Americans' culture views possessions as important because they can be shared amongst the community. That is their goal, to do well so that others within their community will also reap the benefits. However, a person with numerous possessions may not be trusted, and being wealthy is often unwelcome. As healthcare providers, it is important to bear in mind that though American Indians are perceived as one cultural group, each tribe has unique characteristics. Always inquire about your patient's particular tribal customs. Avoid thinking that all Native Americans or American Indians are the same. Native Americans have a holistic view of healthcare. They believe that the physical, mental, emotional, and spiritual dimensions are one. It is important for healthcare providers to focus on their strengths of spirituality, resiliency, and positive identity to help with the healing process. Native Americans often communicate through storytelling. Allow your patient the time to tell their story so that you may get all the information they are trying to convey. Specifically, ask your patient to tell me your story. tribal community is extremely important to Native Americans. Include whoever they say is their family into their treatment plan. Many Native Americans have historical unresolved trauma as it relates to the traumatic events their culture has suffered through European invasion and the event following that. Be aware that this is an impact on their mental health and is manifested in ways such as alcohol, substance, physical, and child abuse. Alcoholism, diabetes, and suicide are the top causes of mortality among American Indians. Chronic illness such as tuberculosis and diabetes are 500% and 390% higher than the general population. Native Americans are twice as likely to suffer from a serious mental illness. Be sure to screen your American Indian patients for the most common causes of death and illnesses common to them.
Pond5.com. Pond5.com. Pond5.com.